Hi, my name is TJ Kilbride, and today I'll be talking to you about the Health Information Exchange, or HIE, as part of my HCM 570-2 Critical Thinking of Module 3, Option 1. This presentation is going to outline several components regarding Health Information Exchange. First, I'll touch on the HIE capabilities, and then I'll move into information standards, interoperability challenges, participation barriers. I'll provide some recommendations, and then I'll wrap up with a conclusion. But before I get into that, for those of you unaware what HIE is a platform that allows various stakeholders to electronically share patient medical information with each other. There are three forms of health information exchange: directed exchange, consumer-mediated exchange, and query-based exchange. Directed exchange allows providers to send patient information such as patient referrals or laboratory results directly to another healthcare professional. Consumer-mediated exchange allows patients to access their medical information immediately. So this type of exchange is usually in the form of a patient portal or other web-based healthcare application. And lastly, the query-based exchange is a database that providers utilize to search for clinical sources on a patient. This exchange is normally utilized when the care is unplanned, such as an emergency room visit away from the patient's home or away from their primary care physician. And now that we know a little bit more about HIE, we can explore the capabilities of HIE. There are several HIE capabilities, and the first I'm going to touch on is how it increases the ability over management ability over the data exchange process. This capability is only achieved if the data being entered initially is accurate. Additionally, the capability will never be achieved if physicians are not on board with the IT systems used to provide HIE. There are a handful of physicians that still utilize paper forms, and they prefer to use paper forms. However, it's our job as healthcare professionals to help guide them towards the use of IT systems. Healthcare information exchange fosters an interconnected environment where medical professionals across the United States and the world can share patient information. The HIE has the capability to improve patient care, safety, and quality of care by the way the exchange can keep doctors from making unintentional medical errors. With an interface that provides information regarding patient medications, previous medical histories, and other important medical information, medical professionals can avoid making a mistake that may cost the patient their life. Another aspect of HIE is that this information is available immediately. This immediate access to healthcare information could be the 5 minutes that saves the patient's life. Not only does HIE impact patients, but medical and non-medical healthcare staff also benefit from HIE. The quick access to patient information can allow offices to work more efficiently, allowing staff members to focus more on interacting with the patients rather than their administrative tasks. With HIE, providers are able to avoid redundancies such as running lab tests or providing medication that doesn't work for the patient. This avoidance can promote a reduction of healthcare service costs for the healthcare facility as well as the patient. And lastly, HIE drives organizations to realize meaningful use directives to improve efficiency and quality of care. By providing medical staff with information when it's needed the most, the quality of care that patients receive may be dramatically better than organizations that do not utilize HIE. But you might be thinking, okay, now that their HIE capabilities are out there, what standards do they have set? Well, in order to exchange data effectively between systems that work on different platforms and operating systems, the Health Level 7 standard was developed. In 1987, the Health Level 7 International Organization was founded. And since then, the organization has been dedicated to providing framework and standards for the exchange, sharing, and retrieval of EHR information. HL7 is utilized in the United States as well as internationally. To ensure that the data is easily understood, HL7 messages are written in an easy-to-read format, and healthcare providers are trained to interpret data shared through HL7 for use in their facility. Interoperability has its own set of standards to ensure that healthcare information exchanged between patients, payers, and providers are all adhering to those standards. The Fast Healthcare Interoperability Resources, or FHIR, are the standards set by the HL7 for interoperability. FHIR enables real-time exchanges of information in the form of messages or documents. And this cuts down on the time needed to receive essential information and can allow providers to begin delivering care to patients or allow patients to receive their information quickly. Now, although there are set standards to interoperability, there are a few challenges that HIE faces with interoperability. Because there are several systems within healthcare organizations, each system may run on different platforms, may be accessed by different types of users, and may be written in a different coding system. Some of these systems may compete against each other. HL7 develops standards that allows information from these systems to be exchanged without having to switch to one unified system or program. When these systems fail to mesh well, information can be lost or require additional reaching out to obtain the information needed. And this is a slow, inefficient way for healthcare delivery. Another challenge that HIE interoperability faces is a lack of training and technical skills for medical staff. Electronic health records require strong infrastructures and user knowledge to operate effectively. However, lack of training can easily be remedied by implementing best practices or developing guidelines to adhere to in healthcare organizations. The challenge is when organizations fail to train staff, workflow and efficiency drops dramatically for public health workers. This makes strong training programs a vital aspect of HIE and EHR systems. In addition to these challenges, there are participation barriers that is faced in the HIE systems. Healthcare information exchange has participation barriers in addition to interoperability challenges. The main barriers standing in the way of effective HIE are patient privacy and legal obstacles. Patient privacy and a reluctance to provide consent are major reasons why HIE initiatives fail. Without disclosure to share information on the HIE platforms, healthcare organizations cannot share information through HIE. It is imperative that patients provide consent to share information between other healthcare organizations to ensure that care can be administered quickly and effectively when needed. In addition to patients being reluctant to sharing their information, barriers have also been created by state and federal health information privacy law. The Health Insurance Portability and Accountability Act allows for electronic sharing of information for treatment purposes and protects providers who properly disclose information liable for privacy breaches by recipients. It's important to note that some medical staffs are still improperly trained on HIPAA guidelines and requirements, making it difficult for organizations to effectively utilize HIE. The privacy rule established requirements for maintaining, collecting, and disclosing patient health information in electronic format to adhere to the rules of the paper forms. Remember those physicians I mentioned earlier that only utilize paper forms? Well, the privacy rule kept that into account and established the requirements for the electronic versions to match those of the paper forms. If the healthcare industry in the United States wants to fully implement HIE in all healthcare organizations across the United States, all states and federal agencies will need to determine rules and regulations regarding patient health information and the exchange of information in order for it to work effectively. Now that we've touched on interoperability challenges and participation barriers, recommendations will be provided. The first recommendation is to provide patients with detailed information regarding HIE. This may alleviate patients' uneasiness to provide consent to their medical information and allow HIE to increase the efficiency of delivering healthcare services. Training programs would provide staff with better resources and skills to effectively utilize HIE systems and interact with HL7 resources more successfully. HIE effectiveness relies heavily on workforce training, technical skill development, and establishing a strong infrastructure that supports data sharing. In order for HIE to be effectively utilized by healthcare organizations, these three components must be met. Lastly, If patients and staff members are provided with HL7 resources, they may become more familiar with how the medical data is being utilized to effectively identify trends in the population health management across the globe. With proper use of HIE, providers can see a reduction of readmissions, improved diagnoses, decrease in repetitive testing, and avoid medication errors. The healthcare information exchange has the potential to reshape how medical information is utilized across the world. By allowing providers to access information in databases, patients in critical care outside of their primary physicians can be identified and provided proper care in a timely manner. Additionally, laboratory results can be shared quickly and efficiently, allowing patients to receive results hours after testing compared to taking days to receive results. Although many offices have perfected the faxing of health information, electronic sharing is more efficient, improves automation of administrative tasks, and can provide health providers with information they need much faster than scanning. By allowing HIE to provide information when needed, healthcare officers can utilize their staff more effectively and provide better patient outcomes. Inoperability challenges that HIE faces can be remedied by proper training and building of a strong IT department. With the proper training, medical staff will know how to utilize HIE effectively to improve patient care and make processes more efficient. Not only will training improve the overall operation of the facility, but patients will be able to learn more about their care and may be more likely to give consent for their information to be shared. And lastly, it's important to note that although the sharing of information is vital in improving healthcare, HIE does not substitute for patient-provider communication. HIE should be utilized with communication with the patient to ensure that the proper care is being provided at all times. And lastly, here are the references I used during my presentation. If you have any questions, feel free to email me or reach out to me in any other form. You have a great night.